It's another Medical Monday on the Vine. We have talked a lot about heart health on our show, and today we're focusing on one of the most common heart conditions, AFib. I sat down with Dr. Pouya Hemmati to learn more. We want to talk about something today that we've heard a lot about, AFib.
Sure.
Can you get into telling us a little bit about AFib?
Absolutely. Thanks for having me.
Yeah.
And so AFib is atrial fibrillation. It's the most common arrhythmia or abnormal heart rhythm that patients in the community have. It's when the top chambers of your heart, which are the atria, don't beat normally like this, and they just kind of fibrillate or quiver. And it comes from abnormal triggers or abnormal areas of beats that kind of overtake your natural pacemaker of your heart, and so then it can increase your heart rate, sometimes to an uncomfortable level, and it can also predispose you to a stroke, and that's why we care about it.
Okay, very good. Is this a common thing?
Absolutely. It's the most common abnormal heart rhythm in America, and there are millions of patients walking around with it, some who don't know they have it.
Okay, so we know that heart disease is the #1 killer in men and women. Is this considered a heart disease?
It is, and the heart disease that we hear about is typically coronary artery disease. It's when there are blockages in the coronary arteries. Well, this type of abnormal rhythm tends to go with other heart conditions. So if you have coronary disease or if you have valve disease, you are more likely to have arrhythmias, especially AFib, as opposed to somebody with a completely normal, healthy heart.
What are the symptoms? Like, what would I feel?
Absolutely. Like I said, there are some people who don't know they have it, so they don't notice. Now with wearable devices like Apple Watches, some people are getting warnings, and that's how they find out they have it. The most common symptoms are feeling palpitations or kind of a fluttering feeling in your chest. So feeling like your heart rate's high, it's irregular, you feel the sensation in your chest. And then if it's really severe, sometimes people can feel like they're going to pass out or they get lightheaded.
Okay, so as a cardiac surgeon, what are the things that you can do if you have said, you say, yep, you have that. What's next?
Absolutely. So a lot of people have it diagnosed by the time they get to me. Those physicians all work together with me as a team to kind of treat this. We have medical options, meaning just giving medicine. We have less invasive options in an EP, or it's kind of like a cath lab, where you can have a procedure done. And then there are surgical options, which I offer.
So the outcomes that you're seeing from the results of your surgery, what have you noticed?
Great. So getting into the surgical options, and I can kind of show you some of these. Sometimes there are patients who have another heart problem, and they also have AFib, and it's really important to not forget about the AFib and treat it at the same time. And then I also do standalone or kind of isolated AFib operations that are less invasive. All of those have different types of outcomes, and I always counsel patients that AFib is not curable. So we can't cure AFib. What our goal is to do is to reduce the burden. So make sure that hopefully you don't go into it, and if you do, you stay in it a short amount of time. The other component is that stroke prevention. I said that you're at higher risk for stroke. It's when that blood is static, when your atria are just quivering instead of beating, that increases the risk of having a stroke. So almost all these patients are on blood thinners, and we'd like to get them off, hopefully. So one component of the operation is to not get rid of, but reduce the stroke risk, and the other is to get you out of AFib. The outcomes are, depending on what operation and how long you've been in AFib, we will quote you somewhere between 70% and 90% long-term freedom from AFib.
That's incredible. If someone watching thinks they may be a candidate, what do they need to do?
One is just you can touch base with anybody. It could be your primary care physician, your cardiologist, if you have an EP specialist, or sometimes I've had patients with AFib come directly to me, and then we get them in touch with the correct people.
Dr. Hemmati with Baptist Health Systems. I'll tell you, I've learned so much. Thank you for what you do, saving so many lives.
My pleasure. Thanks for having me.